Okay, thank you so much. I present this on behalf of my colleagues from Malawi, Lilongwe. As mentioned, we declare no conflict. So again, by way of background, this really, again, what we've already talked about. Use-friendly health services provide access and acceptable and appropriate health care to young people for the age of 10 to 24. Often adolescent girls and young women in Malawi experience high rates of pregnancy, accompanied by suboptimal maternal child health outcomes. Friendly health sexual services and the reproductive services address their unique needs lacking. M2M Malawi, generally M2M is African-based NGO, has employed community health care workers, whom we call peer mentors, in Malawi since 2008 to provide integrated primary health care services. And the way we did this, for us to increase demand for and access to integrated sexual reproductive health services and HIV, including HIV testing, treatment, viral load testing, and suppression among AGYWs and their children. So we recruited 14 adolescent peer mentors in Lilongwe. 11 of them were facility-based. When you say facility-based, these are health facilities in Lilongwe, and 3 community-based. And all these are derived from the communities where they live and they share experiences. So these were trained in HTS, identification, early infant diagnosis, with a focus on timely initiation of ART and implementation of strategies to promote and strengthen adherence and retention. So these are some of the activities that we did to enhance our approaches. One, services related to sexual reproductive health, but focused on AGYWs. This includes family planning, education, pregnancy care, and STI testing. In relation to HIV, it's a full cascade from HIV testing to retention. In terms of children, we are looking at the EID education, case identification, and linking them to care so that they are retained into care. Part of this is also the component of parenting, where we do parenting sessions and early childhood development sessions to support the young adolescent girls and young women. Nutritional support is very key as one of the support to this population. And from assessments to education, and most importantly, to encourage them to exclusively breastfeed their children. And of course, yesterday we talked about mental health. It's very important that we did provide individual or group-based psychosocial support. So based on this, our reach that we observed for the period 2021 to March 2022, these are about 8 months. So we created about 8, we did conduct about 8 demand creation sessions in the facility, in the 4 facilities that M2M is supporting, and reached over 2,000 households. Out of these, we were able to reach more than 2,300 AGYWs. So in terms of HIV testing, 416 adolescent girls and young women who didn't know their HIV status were identified and referred for HTC. And in this, we did register 73% getting tested and identified 13 new HIV infections among these. And as you see, again, the maternal youth where maternal girls and young women were the ones really identified quickly, 8 pregnant and 5 breastfeeding. So all of them were initiated into ART, but of course there were delays for some of them. The 5 were delayed to start, and some of the challenges that led to this delay include their readiness to start treatment. They had to consult. Also, to consult their partners and their significant ones, whom they feel are very important. Also, seeking guidance from family members before making a decision. And this is, I think, very important. Even yesterday when we had sessions on mental health, family support is very important for retention and adherence to treatment. So EID, of the 318 funds who were due for testing, 75 were tested, 93 received results. So we noticed in that period 1 child zero-converted at 12 months and was immediately also linked to care. So just to disaggregate this into age, as you'll see, at 6 months, at 6 weeks, we saw a number of children receive a test and also results. But as you go through the cascade, this has reduced from 12 months and also at 24 months. This indicates that there is need, again, to focus on children as they grow. So a lot of effort is done in the early stages of life, or early stages in the young children, but later as they progress through their care, they kind of, they need specialized interventions. So as I conclude, we believe that peer-led community HIV interventions integrated into existing services are effective and they can bring about sustainability. And also tailoring and comprehensive programming effectively engages AGYWs. Adolescent peer mentors can successfully create demand and they support adolescent girls and young women to access HIV and EID services, even in difficult or hard to reach communities. So we continue with continued efforts and are essential to close the gap for HTS uptake, achieve complete EID among infants, and enhance family and support engagement in ART initiation and strategies for AGYWs. We acknowledge the colleagues highlighted here. Thank you so much.